Okay, hello doctors. I hope you are well. So as I committed with few people that I will make a YouTube video that how to do the write-up for RCS England and Glasgow because it's a bi-collegiate exam, right, for Glasgow and England. So these are the basic things like both Glasgow and England have the same template and this template can be found on their website. So first of all, like what I noticed, the template which is present on the website. I'm going to open the website. Just give me a second. So the template present on the website, like when we save it into PDF at the end, it do not save very well. So I don't know. I believe that there are some security restrictions. Um, so it's always better to change RCS England, Morth. Let me share my screen. Okay, so now my screen is shared. And so this is RCS England. And if you go in membership in orthodontics, yeah. So this is a case presentation template that is there, right? It's the same for RCS England and Edinburgh. RCS England and Glasgow. But I've seen that many times when people save it, things become haphazard. So one thing is like you can make your own file, copy paste it on a page, and keep on doing that. Because somehow this template had problem, especially when we save it into PDFs, right? So the problems appear. So it's very common, right? So just keep this in view because many a times people have saved the case, then they have to cut paste the same way. Like you can make your own Microsoft Word. Like you can start with page one, cut pages from here and put it on your own page and start writing there. So anyway, so starting from the first page, right? You do this page, you do the case summary. The case summary follow a logical order, right? It's not like haphazard. So this is one of the standard case summary, like the extraorals, the age, the chief complaint, the medical history, then the incisor relationship, right? So this is basically a write-up. You cannot make mistake in a write-up. Like they want to see that the same pattern that you are writing a case report. So if you make mistakes here, even writing mistakes, they do not take it very well and they do deduct marks. Like C should be capital. People make this mistake and keep C smaller. And relationship, not relation. So people make mistake. And if you see here, the pathology come first in the third line, and then the biggest problem, which is in the IOTN, and then the smaller problems, and eventually the IOTN itself. And later on, the treatment plannings, right? Um, and this is a standard solve template by RCS Edinburgh, right? So this is an old template. I think they used to call it 2013 template. So I provided you people in the WhatsApp group yesterday. So at the end, many people, like it's a good practice, they put the pictures there. So if you've done a growth modification, you can put the profile view. If the smile looks more better, you can put a frontal view in smile, right? So as you want to change the treatment changes, show the treatment changes here. So even you can take this format as a reference because it's written by the RCS Edinburgh and start solving your own case. So like these are the pre-treatment assessments, straightforward. As I said that you can download the template from there, go with this RCS Edinburgh template, right? And start putting this line and then start changing these lines according to your own case. So, and also like I've given this example yesterday, it should be in a symmetry. Like this 7 is there, they will deduct marks because it's a write-up. So you have to do the right write-up, right? So things should be in symmetry. Like this way, right? So always try to keep things in a symmetry and take a template because once you have a template, you know what you are going to write. Things become easier for you. Oral hygiene, the caries, erupted teeth, like this one is given in a table, right? Like one word is over the other. So In maxillomandibular arch, you have to write the crowding, the incisor inclination, the canine angulation, and significant like rotation and the arch form. Many times, like people write the arch form after this. So anyway, there is no rule of thumb in this. So here the incisor relationship for incisor classification, um, you write like the incisor relation. For OJET, sometimes people are confused because they find a case where it's class one written like class one incisor on, sorry, OJET increase on one and decrease on the other. So you can mention that 3 mm OJET on this specific incisor, 20% overbite on that specific incisor if this like multiple teeth are in different occlusion. So displacement is ICP RCP discrepancy, right? Many people confuse it. So I just removed the extraorals, and for the extraorals, they should be in a symmetry, right? If you see here, they're in a symmetry, right? So what I have seen from people like this way, right? So it's definite that they will going to deduct mark in the exam, right? So you see the intraorals, they are in a symmetry, right? Like if I make a straight line, so it's a write-up, keep it as a write-up, keep it as standard, like if you see here, they're all in one line, right? They want a symmetry. So wherever possible, go for the symmetry. Sometimes our pictures are cropped, so we have no other option, but try to keep a symmetry here, right? Like many people, what they used to do, they will they will cut this picture and put another picture within it, like, right? Take their own picture, put their own picture. So keep the same ratios. So going back to our template, because the RCS Edinburgh template is something like 34, sorry, more than 40 pages. So pictures, if you see, they're in a symmetry. Study cost. You can take pictures of your own models, right? Like with the basis. Uh, like these days, a good option is get your cost scan, make digital models. It just take like 1 hour for one case, and you are good to go. Like the presentation is much more better than the physical cost. And obviously, you don't have to take the physical cost. I mean, the pictures of the physical cost, right? So at no point the picture of the physical cost can, compete with these pictures of digital models, right? So this one is just scan of the traditional models. It's not intraoral scan, right? And then this candidate just made the pieces over them. So rest is like you follow the template, like I provided you for RCS England, Edinburgh, sorry. So the X-rays, and you see here, this one is made by Dolphin. You can use WebSef. I will tell you the limitation of WebSef, right? You can also go with a good hand tracing. And what people do, the initial should be black, and people are not bothered. They put blue or red. It means that they are going to deduct marks there. So this is very important. If you are like having a rub case, go with the rub norms. They are given in the handbook of orthodontics, right? I think new chapter 7 for different facial norms. There are like few values that are different. Otherwise, you can write this line, right? And you are good to go to follow the traditional Eastman values, which are given in the RCS England or Glasgow, template. So also soft tissue is not there, but I like to have soft tissue because it will give you some room for discussion, right? So what I have seen in many candidates, they write it just one line. It should be one line. You should be explaining, like you should be explaining your SNA, SNB, MMP, and facial height, then the upper and lower incisor inclinations, then the interincisor angle, the E lines. They shouldn't be like this way. People just write 3 lines here. So it shouldn't be like that. You should explain them, right? Especially in the after the superimposition, the final, cephalometric values, you have to explain them a lot. You have to give the etiology of the malocclusion. If there's skeletal, give the skeletal. If there's dental, give the dental values. So you have to write all the etiology of the malocclusion. Aims of treatment are very important. They should be organized. Like I've done the restoration, give the oral hygiene instructions, then relieve the crowding, then put the braces, then like level line, coordinate the dental arches. So they follow the flow of treatment, right? It shouldn't be a haphazard aim. Like many of the feedbacks I've read from the examiners, like with the examiners wrote to the candidates once they have failed the exam. So they have written categorically that the etiology was not good, the aims were not good. So this is a page with the examiner must read, right? Like the case summary, they would read it, the cephalometric values and their explanation, they would read it, right? So this is a must-read page for the examiners. Like here, they read the treatment plan. They are less bothered about the other things, but the rationale and the prognosis, they are more like classical lines, right? And you have to follow a template to write those lines more or less. And then the sequence of treatment. They shouldn't be very long, like people place 25, 30 key stages. It should be key stages. Like you shouldn't be placing that I place a separator, patient came to me, then I put the ligatures, right? Just the key stages, I believe 10 to 12, 13, that's more than enough. If it's a growth modification case, you can go up to 15, but usually 10 key stages are more than enough, right? And write the full number like inches, right? Because it's a write-up and the examiner is marking you in absentia. Then in mid-treatment, that is very important. You write what you're doing, right? It actually helps you in Viva too. So just write what you're doing underneath or above every picture, right? In this case, it's written beneath, but you have to write in every case like what you're doing there. So again, like red color, it's post-treatment. If it's blue, it would be like mid-treatment. So there's specific colors for tracings, right? You won't go for blue color everywhere because people used to do it. So this is dolphin superimposition, right? So dolphin is the best choice, but you can also uh, um, have other softwares which can do structure superimposition because they ask for structure superimposition. So I have seen candidates which didn't got ample time before the exam, and so what they did, they went for, WebCEF. And in WebCEF, the WebCEF is not very good in structure superimposition. So what they did, they went for ascent plane superimposition, and in the maxilla, they went for inner contour of the maxilla superimpositions, like here at this point. So I haven't seen any candidate which went for WebCEF and got 4 out of 4, but they did pass the exam with average cases too, right? So you can do a good hand tracing versus a dolphin. I believe that they get equivalent numbers. WebCEF, then go for ascent plane superimposition. As I said, that WebCEF is not good in structure superimpositions, right? There are other software like AutoCEF, but I haven't, seen candidates coming up with those superimposition from those, softwares. So these are the post-treatment, and you have to write the treatment changes. People just write post-treatment and pre-treatment, but you have to write the treatment changes too. So it's post-treatment minus pre-treatment. So be careful about it. People do the other way around too and get confused when they are writing these values. So you must not be confused there. And also, if you see these values are in a symmetry, they are not haphazard. And then when it comes to, summary of the treatment changes, people again write 3 lines, right? The candidate which usually fail or get less numbers. You have to explain all the values, right? Like you have to also explain what's happening on the superimposition, like I explained you. Mandibular superimposition shows retraction of lower incisor and visualization of lower molars. So you have to explain what's happening in your cephalometric changes on your cephalometrics, right? Everything here. So end of treatment, again, the models, you have to put the retainer pictures. In this case, it's not there, right? But you have to put it. You must know how to calculate PAR because many people just write 100% here, right? You must know how to calculate PAR, right? It's, I believe, like pre-treatment minus post-treatment divided by pre-treatment multiplied by 100. So you must know the formula, how to calculate PAR and the right percentages there. And the last page is more or less in critical appraisal, right? It's more or less like a template. You only have to write few different points, like, everyone write that smile improved markedly with relief of crowding alignment of teeth, right? So they change it according to their own case. So this is more like classical. This is more like classical, smile aesthetic classical. Slightly vary according to the case, but it's the same line. People just manipulate them. here people write some things like which happen in that case, maxillary teeth and the mandibular teeth, the critical appraisal. Retention is again more like classical, right? You just put your retainer and write the classical lines. So I hope that would be helpful. So thanks a lot for watching. If there are any questions, just let me know.